Hello students, today we will discuss about the perineum. Now in today's lecture we will not see the details of any part of the perineum, but basically we just try to understand the concepts of the different components of the perineum, because most of the students are getting problem in understanding what are the boundaries, what is the division of the perineum, what do you mean by the perineal membrane, and what are the different pouches which you read in the perineum. So today in this section I will tell you about the concepts of different basics of the perineum. So let's start with the perineum. So the first thing should come in your mind that where I will found the perineum. So what is the position or the location of perineum? So when you will see the trunk from in a sequence, if you will start from above to the downward, you will have the thoracic cavity, and it is separated from the abdomen by the diaphragm, so you will have the abdominal cavity. Now when you will go lower in the abdominal cavity, you will have the pelvis, and below the pelvis you will have the pelvic outlet, and in that region you will found the perineum. So if you will see here the sequence of the structures, so this is your chest cavity. Now below the chest cavity, this is your abdominal cavity, and below the abdominal cavity you will have the pelvic inlet that is in the continuity of your abdominal cavity or peritoneal cavity. But when you will go below the pelvic cavity, this is your pelvic outlet. Now this pelvic outlet, which is exit of your pelvis, is having the perineum, and the partition is there, and the partition between the pelvis and perineum is having a diaphragm, and that is known as pelvic diaphragm. So in general terms, if you will see, you will find that abdominal cavity is having two diaphragm. One is at upper end, that is the biggest diaphragm of the body, which is known as thoraco-abdominal diaphragm, and one diaphragm at the outlet of the pelvis, that is known as pelvic diaphragm. And perineum is not present between these two diaphragms. Perineum is present below your pelvic diaphragm. Clear? So this is the first thing where you will find the perineum. Now second thing is that the part of the trunk which is inferior to the pelvic diaphragm is perineum. And what is pelvic diaphragm? Lower limit of your pelvis. The perineum is the region at the lower end of the trunk, and it lies in an interval between the two thighs. Now this is what you have to understand, that perineum is not visible in anatomical position. You have to see the part of your thigh position if you want to see the perineum. So you have to make the patient lie down, and then you ask the patient to laterally rotate their lower limb, so the thigh will go apart, and this hidden area from the below is visible. So the perineum is the area which lies on the inner side of your upper part of thigh. The external genital areas are located in the perineum. Clear? So this is what you have to understand where you will find the perineum. So what are the boundaries of the perineum? So I just told you that perineum is the lowermost part of your trunk, and that is also known as pelvic outlet. So this is what you have to understand, that perineum lies below the pelvic diaphragm, surrounded by the pelvic outlet. So what are the bony boundaries of your perineum? So when you will see the bony boundaries, first is anterior boundary, posterior boundary, and right and left side boundary. So when you will see the anterior side, on anterior aspect, you will have the bone is the pubic arch and the arcuate or inferior pubic ligaments. So in this image, you can see the inferior view of your trunk, or I should say the pelvic outlet. Now in this pelvic outlet, you can see that this is the pubic symphysis, and this symphysis is having a connection below, is known as the inferior pubic ligament or arcuate ligament. So this is the anterior boundary of your pelvic outlet or perineum. Now what is the posterior boundary? The posterior boundary is the tip of coccygeus. Then what are the right and left lateral boundaries? So lateral boundaries are formed by the conjoint ischiopubic rami anteriorly. So anteriorly you will have the two ramus which are coming from the pubis and going to the ischial tuberosity. So they are known as conjoint ischiopubic rami. And you will have the ischial tuberosity itself with a connection of tuberosity with the sacrum is known as sacrotuberous ligament. So where is the sacrotuberous ligament? So this is your sacrotuberous ligament on both the sides. So you will see that it is a boundary which is diamond shaped, and this diamond shaped pelvic outlet is known as the boundaries of perineum. Now when you will see the boundaries on skin, that means on the surface marking, you know that the bones are covered by the different part of the soft tissues. So if you are having a patient and you want to mark the perineum, you should first give this position which is known as lithotomy position. So I just told you that perineum is a hidden area between the upper side of your medial compartment of thigh. So you have to make the person supine with the flexion at your hip joint and lateral rotation. So once you will have the flexion and lateral rotation of the thighs, now the area which is visible from the below, you can have the markings of your pelvic outlet. But you can see that this pelvic outlet shadow which is visible here, the bony areas are covered by the skin. So then what are the landmarks? So landmarks is become the scrotum in the males and the mons pubis in case of the female. So this is the scrotal area, this will become the anterior point, and in case of the female, this mons will become the anterior point, which is correlating the pubic symphysis. Then you will have the posteriorly the buttocks. Now these buttocks are actually demarcating your sides where you will have the buttocks which are actually overlapping your ischial tuberosities and sacrotuberous ligament posteriorly. And on the side you will have upper part of the medial side of the thigh. So this upper part of the medial side of the thigh is actually covering the muscles which are arising from ischiopubic rami. Clear? But in short, if I have to look for the perineum in a living person, we should need this lithotomy position. Otherwise, I cannot appreciate the perineum. And perineum is having the openings of genitalia, which you can see in males. You will have the penile part, you will have the vaginal canal in the females, and you will have the anal canal in both male and female. Now, here if you will correlate both these boundaries, these are the bony boundaries and this is the boundaries on the skin, you will realize, which I just told you, that when you are having this question on the surface marking, you have to understand that this coccyx or this posterior point is behind this anal canal. So where is the anal canal in this image? So this is the anal canal. So you have to understand that posterior to the anal canal, you will find this point, that is the tip of coccyx. And when you will have the sides, on the side, this is your conjoint ischiopubic rami, and in case of the living person, this area is covered by the uppermost part of medial compartment of thigh. And when you will see the posterior placement of the sacrotuberous ligament, and you know that this ligament is covered by the gluteus maximus, so you will have the buttocks which are actually covering your this posterior boundary of sacrotuberous ligament. Clear? Now, in short, if you are having in viva, define perineum or what is perineum. So your answer is that the area enclosed by the boundaries of pelvic outlet lies below the pelvic floor is called as perineum. So this is the simplest definition of the perineum, which you can appreciate here, that when you are seeing from the below, you can see that it is your pelvic outlet which is bounding the perineum, and the area which you are able to see here, the muscles which are visible here, these are the muscles of pelvic diaphragm, and we are talking about the gap below the pelvic diaphragm. Now in this vertical image, if you will see, you can find that this area, or you can say this cup shaped structure, is nothing but it is a attachment of your pelvic diaphragm or pelvic floor. Now below this pelvic diaphragm, you will see that there is a space is present. Now this whole space till your skin of buttocks is known as perineum. Clear? So this area which is here below the pelvic floor, bounded on both the side by the ischial tuberosities, and it is going up to the skin, is your perineum. So this concept has to be clear in your mind, that if somebody is asking what is the difference between the perineum and pelvic cavity, you should say that this pelvic floor divides the perineum and pelvic cavity. The area above the pelvic floor is pelvic cavity, the area below the pelvic floor is perineum. Clear? Now, how you divide the perineum? So this is the next part of your concept, that when you are having the whole pelvic outlet, you can divide this pelvic outlet into the two part by a imaginary line, and that transverse imaginary line join the two ischial tuberosities. So there is a transverse line joining the anterior part of the ischial tuberosities and passing immediately anterior to the anal opening or the anus. Now here in this image you can see where is the anal opening. So this is your anal opening. Clear? Now if you will draw the line, this line which is passing just anterior to the anal opening divides this whole inferior part or the pelvic outlet into the two triangles. So what is the division? Anteriorly placed is known as urogenital triangle, or the posterior placed is known as anal triangle. Now why we are using these words? Because in this posterior triangle you will find the anal opening, that's why it is known as anal triangle, while in this anterior part you will find the opening of your urinary system and genital system. So what are these openings? In case of the male you have the penile urethra, in case of the female you are having the urethra as well as vaginal canal. Now what about the anal triangle? So where you will find anal triangle? Posteriorly. So this is your anal triangle. Now in this anal triangle, on both these sides of anal canal or anus till your skin of buttock, you are having the empty space. Now this is your section which you are taking in coronal plane. Now in this coronal plane section, first you have to understand, we have to find out the pelvic floor. So where is the pelvic floor? Now you can see this muscles. Now I just told you that pelvic floor is having the cup shape or bowl shape pattern or the orientation. So the muscles are going downward and medially. So you can see the muscles are going downward and medially. That means the area above this pelvic floor, now this part is known as pelvic cavity. But the area below this, that means this area, is known as your perineum. Now in anal triangle, you are having the anal opening and the area below the pelvic floor, that means this gap below the pelvic diaphragm, inner side of the hip bones, is known as ischioanal fossa. So the anal region contains the termination of anal canal in the midline, and on both the side it is surrounded by the fatty filled areas which are known as ischioanal fossa. Clear? So my dear friends, this is the most important concept to understand, that if somebody will ask me where is the location of ischioanal fossa. So in one line your answer is that it is present below the pelvic diaphragm because it is a part of perineum, not pelvic cavity. If I will say pelvic cavity, then this portion should be above the pelvic diaphragm. But in definition of perineum, we are using the word the area below the pelvic diaphragm. That's why this ischial fossa lies below the pelvic diaphragm and it surrounds the gap or the area present in this part of your perineum. Clear? Now, what is urogenital triangle? So, the urogenital triangle, as the name itself suggests, is having the external urogenital organs. Now, what are these external urogenital organs? Like in case of the male, you have the penis, you have the scrotum. In female, we have the vaginal canal. In the urogenital triangle, further, you will have this concept which is very, very important. Now, see how we are dividing the perineum. We have divided the perineum in two parts, anal triangle and urogenital triangle. Now, the important thing which you have to understand that anal triangle is no more further divided, but this urogenital triangle is further divided into the two parts with the help of a partition, and that partition is known as urogenital diaphragm. What is that? Urogenital diaphragm. And in this urogenital triangle, you are having the area above the diaphragm and below the diaphragm. Now, area above the diaphragm is known as deep perineal pouch and below you have superficial perineal pouch. Clear? So, the urogenital diaphragm, there are superficial perineal space or the pouch and the deep perineal space and the pouch. And these spaces are separated by the perineal membrane, and this membrane is actually the inferior covering of urogenital diaphragm. So, my dear friends, the question is here that what is the definition of superficial perineal pouch? So, the answer is superficial perineal pouch is the area which lies below the perineal membrane. And what is the deep perineal pouch? The area lies above the perineal membrane. So, I will show more diagrams in the coming slides to make this concept more clear. So, now first you should understand what is perineal membrane. So, this is the basic thing when you are reading the perineum. Most of the time, most of the students are getting this concept difficult. So, let us talk about the perineal membrane. So, perineal membrane is the inferior fascia of urogenital diaphragm. Now, this is very clear to you that when we are talking about the lower part of the trunk, there are two diaphragms. What are the name? One is pelvic diaphragm and another is urogenital diaphragm. This is the first thing which you have to understand, that when we will talk about the pelvis, in the pelvis you will have the two diaphragms. One is pelvic diaphragm, another is urogenital diaphragm. The second thing is that pelvic diaphragm is a complete diaphragm. That means it starts from the all circumference of the pelvis. It starts from anterior side, lateral side and posterior side, and the fibers are going downwards and medially, and they will make a hammock-like structure to support your organs present in the pelvis like urinary bladder, uterus and rectum. But when you will go below this pelvic diaphragm in perineum, you will find one more incomplete diaphragm which is present only in anterior triangle between the two pubic bones or in this pubic arch. And that diaphragm is known as urogenital diaphragm. Now, the second concept is, what is diaphragm? Now, if somebody will ask you, what do you mean by diaphragm? So, diaphragms are the musculofibrous or musculotendinous partitions. For example, if you will see the thoracoabdominal diaphragm, it is having the muscles and the center part is aponeurotic. So whenever we are using the word diaphragm, most of the time we will have the muscles which are actually making a partition and we are labeling them as a diaphragm. So now this concept is clear that levator ani is a muscle of pelvic diaphragm. In the same manner, if you will have the urogenital diaphragm, it is also made up of the muscles. So when you will have the urogenital diaphragm or a muscle, it is covered by the two layers, upper and lower. Now this lower layer is visible from the front. So here you can see that these are your two pubic arches. Now between these two pubic rami, you can see this green color triangular sheet. And this sheet is visible from below, which is actually the inferior covering of the muscle which is stretching from one side to another side. And this covering of the urogenital diaphragm muscles is known as perineal membrane. So now what is perineal membrane? So perineal membrane is the inferior. It is the important word that it is the inferior covering or the fascia of muscles of urogenital diaphragm. This fascia sheet stretch horizontally across the pubic arch below the urogenital diaphragm. So this is what I am saying again and again, that it stretch horizontally across the two pubic arch. And why between the two pubic arch? Because it is covering the inferior surface of the muscles which are stretching between the two pubic arch, and those muscles are known as urogenital diaphragm. Now, in this video clip, you have to first understand that what is the relation of perineal membrane and the pelvic diaphragm. Why I am showing this clip? That most of the students think that the perineal membrane is the inferior covering of pelvic diaphragm. No, it is not the inferior covering of pelvic diaphragm, it is the inferior covering of urogenital diaphragm, and urogenital diaphragm lies below the pelvic diaphragm. So let's see this clip. So this is your anatomy position. Now you are rotating it first on the anterior aspect, and you can appreciate this inferior covering of urogenital diaphragm, which is known as perineal membrane. Now we'll make it again in the neutral position, and now you will see the placement of the muscles forming the pelvic diaphragm. Now you can see that pelvic diaphragm muscles are taking origin from the posterior side of the sacrum also. They are taking origin from the ischial spines also, and these muscles are also taking origin from the pubic arch also. So this cup shape area or bowl shape, this circular muscle which is present like a hammock in the center of the pelvis is pelvic diaphragm. And now you can see that this membrane is present in the anterior aspect of your perineum, which is known as urogenital diaphragm, and this muscle, this membrane is not actually adherent to this urogenital, this pelvic diaphragm. So this is the important thing to understand, that perineal membrane is not the covering of pelvic diaphragm. It is a covering of urogenital diaphragm. For that we will see the more diagrams in the coming slides. So now the next concept comes is that how to divide the pouches, or what are the pouches of your perineum. So whenever you are talking about the pouches of perineum, I am always talking about the urogenital triangle, not anal triangle. That means the pouches are present in anterior part of perineum, not in the posterior part of perineum. So what are the pouches? There are two pouches, superficial pouch and deep pouch. And what is the line of demarcation between the superficial and deep pouch? Answer is perineal membrane. So this deep pouch is also known as urogenital diaphragm or the deep compartment. Now see, this is again the important concept to understand, that there is this is your anterior abdominal wall, which will continue in the penile skin. This is your scrotal part, and then this is your pubic symphysis. Clear? Now when you will see the perineal membrane, below that, this is your perineal membrane. Now you have to understand this concept that this area of below the perineal membrane, this area is superficial pouch. And I told you what is perineal membrane? Inferior fascia of urogenital diaphragm or the muscles of urogenital diaphragm. So where is the muscles of urogenital diaphragm? Suppose you are having the muscles of urogenital diaphragm here. So now you can see that where is the deep pouch? So deep pouch is this actually. Now this is itself known as deep pouch. So deep pouch is the synonym of urogenital diaphragm. If somebody will ask you, write the short note or write the question on urogenital diaphragm. So what you are writing? Muscles of urogenital diaphragm, like deep transverse perineum. But suppose if somebody will ask you, what is the content of deep perineal pouch? Again, your answer is deep transverse perineum. That means the urogenital diaphragm is the synonym of deep perineal pouch or deep perineal space. So the muscles which lies above the perineal membrane are known as deep perineal pouch. Now in this image, you can see that you are seeing from the posterior side and you are able to appreciate the posterior free margin of perineal membrane which is here. I already told you that the urogenital diaphragm is an incomplete diaphragm. This diaphragm is not approaching till the sacrum. The diaphragm which is coming from all around is your pelvic diaphragm. So in this postero-inferior view, you can see this origin of different parts of the pelvic diaphragm. Now below the pelvic diaphragm in anterior triangle, you can see this is the perineal membrane. And you are appreciating the posterior free margin of perineal membrane. Now below the perineal membrane, here you are able to appreciate that this area is your superficial perineal pouch. And where is the deep pouch? If I have to mark the deep pouch is this area where we will have the muscles lies just above your perineal membrane. So my dear friends, this question has to be very clear in your mind that what is deep pouch. So deep pouch is nothing but it is a muscular area between the perineal membrane and the lower part of or the inferior surface of pelvic diaphragm. So this inferior surface of pelvic diaphragm and the superior part of the perineal membrane is having the layers of the muscles, and these are known as your urogenital diaphragm. And what is the superficial pouch? This area below the perineal membrane is known as superficial perineal pouch. Now, when you are talking about superficial perineal pouch, I just told you that the superficial perineal pouch is the area which lies just deep to the skin, fatty layer or subcutaneous tissue, and the fascia present in the skin is known as colles fascia. Now here in this image, what you are able to appreciate? Now you have to first understand that this shadow is your membranous layer of anterior abdominal wall, which is known as Scarpa's fascia. Now this Scarpa's fascia then continue as a fascia of your penile region and the fascia of scrotum. That is known as Buck's fascia in the scrotum, in the penile region. Now this fascia, then it will enter into the perineum, and here you can see that this is your colles fascia which is going into your perineum. But the interesting thing is that this colles fascia is going to merge with the posterior free border of your perineal membrane. I just explained in this diagram that the posterior border of perineal membrane is free, and this superficial pouch is now in this image looks like that it is continue here, but it is not like that. the superficial space is not continue posteriorly in anal triangle. Why? The reason is this diagram. Here in this diagram, you can very well appreciate that there is a layer which is known as colles fascia. Now, this colles fascia is going into the perineum and it is merging here with the posterior free margin of perineal membrane, and on the side it will merge here with this ischiopubic border. So, what will happen that this superficial space is now limited all around, and whatever the structures are there, they are remain on below and anterior to the perineal membrane. So, this is what you have to understand, that superficial perineal pouch lies below or superficial to the perineal membrane, and this pouch is closed posteriorly by the attachment of colles fascia with posterior free margin of perineal membrane. Now, this image will clear you this concept more. Now, where is the superficial perineal pouch? So, you have to understand this is the superficial perineal pouch, and this is also continue in the scrotum as well as in the penile area. Where should be the perineal membrane? So, this should be the attachment of perineal membrane here in urogenital triangle. That is the inferior fascia of urogenital diaphragm. So, in this image, now it is clear to understand that whenever you are doing the dissection and you are, as soon as remove this skin, and as soon as you will remove the skin of this base area between the upper part of the thigh, you will find a gap, and this gap is known as superficial perineal pouch. Clear? Now, what is deep perineal pouch? So, again and again we are using the word perineal membrane as a line of demarcation, and the muscles on the upper part of perineal membrane are known as urogenital diaphragm, and that is a synonym of deep perineal pouch. So, the urogenital diaphragm and the deep perineal pouch or the compartments are two terms for the same reason. So, this is the important question. Clear? The second thing is that urogenital diaphragm is made up of muscles, which I already told you that it is a fibromuscular structure and it consists of two layers of the fascia. So, in this image you can see this is a triangular diaphragm. Why triangular diaphragm? Because it occupies the space between the two ischiopubic rami. Now, in this space, in this diagram, you can see that this is our upper fascia or the upper layer of the urogenital diaphragm, and this is the lower level of lower fascia of urogenital diaphragm. And between these two layers, or it is a sandwich like arrangement, you will find that muscles are present, or the muscles are filling these gap between the two layers. So, in both male and female, you will find that muscles are present between the two facial covering, and these muscles between the two facial coverings label as urogenital diaphragm, or I will label it as a deep perineal pouch. So, this concept has to be there in your mind, that most of the time students are having this confusion that what is the difference between the superficial and deep pouch. Now, the important thing is that urogenital diaphragm, which is a fibromuscular, consists of the two layers, and I just told you that the inferior fascia is known as perineal membrane, and in the same way it is also covered by the superior fascia, which is not having any special name, and these facial sheet stretch horizontally across the pubic arch along with the muscles. Now, the urogenital diaphragm, if you will see the boundaries, bounded laterally by the ischiopubic rami, and it lies below the pubic symphysis. So, this is the ischiopubic rami where you will have the gap, and in this gap below the your pelvic diaphragm you are having the urogenital diaphragm. Now the deep transverse perineal muscle occupy most of the space. Now what is this deep transverse perineal muscle? Again I am saying that always whenever you are having the diaphragm, you are having some names of the muscle. Like in pelvic diaphragm, you have the levator ani muscle. In the same way, if somebody will ask you deep perineal pouch or urogenital diaphragm, then you should have this word in your mind, deep transverse perineum. Along with the deep transverse perineum, you are having one circular muscle around the urethra, and this muscle is known as external urethral sphincter, and this is circularly arranged muscle, and this is an important muscle for voluntary control of micturition. Clear? So now, the basic concept which you have to understand, that what is the superficial pouch and deep pouch. So superficial pouch is below the diaphragm or below the perineal membrane, and deep pouch is nothing but the urogenital diaphragm itself is known as deep pouch. So what is the relation of the pelvic and urogenital diaphragm? Now this is again a very fundamental concept to understand, because when you will see the anterior part of the pelvic diaphragm, suppose if I will remove the areas or the muscles and all the fascias below the pelvic diaphragm, you will find that there is a spaces present between the lower part of the hip bones and your this hammock-like pelvic diaphragm. Now I already told you that that space is known as perineum, but if you will see anteriorly, you will find there is a big gap is present in pelvic diaphragm. Now this weakness which is present in the anterior part of the pelvic diaphragm is further supported by one more layer of your diaphragm, and that is known as your urogenital diaphragm. So my dear students, you have to understand that if I am doing dissection from the below, if you will remove this genitalias, if you will remove the skin from here, you will find the contents in the superficial pouch. You will remove the superficial pouch contents, but still you are not able to see this gap, because this gap is further supported by the urogenital diaphragm. And once you will remove the urogenital diaphragm from here, after that you are able to appreciate there is a quite gap or hiatus in anterior part of this pelvic diaphragm. So the pelvic diaphragm form the most of your pelvic floor, and the anterior region of the pelvic diaphragm is having a U-shaped defect, and this defect is allow the exit of your urogenital system like vaginal canal, like urethra. And the pelvic floor, this part of the pelvic floor where you have this U-shaped defect is supported by the muscles, and these muscles are forming the deep perineal pouch or the urogenital diaphragm, and the inferior membrane of this is known as perineal membrane. So now in this image, in both these images, you can make the difference. Now I just explain you that this area which lies here has to be your urogenital diaphragm, and inferior to that you will have the perineal membrane. Now in this same image, if you will see, we have placed the perineal membrane. So this is the perineal membrane which you can see here. Now this perineal membrane is now dividing this whole space into the two parts. One is the area above, so that is the area, and one is the area below. So this lower area is become superficial pouch, and this above area is become deep pouch, and this deep area is further filled by the muscles which are known as urogenital diaphragm or the deep pouch. Now in this image, now this is very important clip to understand when you are going from outside to inside. Now here you can see first all around this part of the perineum is covered by the skin, and perineum lies high between the upper medial aspect of the thigh. So this is the first outer covering is skin. Now suppose if you will remove this skin of the upper part of the thigh, scrotal skin and penile skin, you are able to appreciate the layer, and this is your colles fascia. Now if we remove the colles fascia also, now you will find the muscles, and plus you will find the cruras which are entering into the penile portion. Now, if we will remove these muscles like ischiocavernosus and the crus of the penis, you will find that there is a globular muscle is appear, and this is known as bulbospongiosus. Now, immediately as soon as you will remove, you will find this green color structure. This is your perineal membrane. Now, this perineal membrane is now visible. Now, where is the perineal membrane? So, you have to first understand. Now, you can see this perineal membrane is visible. And below the perineal membrane, this is your bulb of penile area, where you can see this is the urethra. What is that? This is your urethra of penile region. So, this is what you have to understand, that what is superficial perineal pouch. So, when you are doing the dissection from outside to the inside, you have to remove the skin, you have to remove the colles fascia, and then you will find these contents. But my dear friends, you have to understand that you have all the structure below the perineal membrane. Like here you will have this muscle which is known as superficial transverse perineum. So, this is the conceptual thing to understand that what is superficial perineal pouch. So, in this diagram you have seen that we have to remove first skin, you have to remove the superficial layers, you have to remove colles fascia, and colles fascia was actually attaching here on this posterior free margin. It is coming like this. So, as soon as you will remove this colles fascia, you will enter into the superficial perineal pouch, and in this pouch you first find out, in case of the male, the cruras and the crus of your penile portion, and at the end you will find this bulbospongiosus, and in this bulbospongiosus you will have this urethra. Clear? So, these all structures are below the perineal membrane, that means they are inside the superficial perineal pouch. Now, what is the communication between the gluteal region and perineum? Now, this is again a very important concept to understand. Now, when you will see this hammock-like arrangement of your pelvic diaphragm, you have to understand that pelvic diaphragm is now has divided your pelvic cavity into the upper large cavity, which is known as pelvic cavity, and the lower part is the perineum. But there are some structures, those will go from pelvic cavity to the perineum, and there are two ways. One, either they will puncture the pelvic diaphragm to enter into the perineum, or second way is that they will go posteriorly into the gluteal region and then re-enter into the perineum. So, this first way is not there. The second way is present in the body. That means when you will see the communication, the pelvic cavity, that means the area above the pelvic floor, and the perineum, that means the area below the pelvic floor, communicate with which foramen? Answer is lesser sciatic foramen. Why lesser sciatic foramen? The answer is here. The lesser sciatic foramen position is important because it lies below the attachment of your pelvic diaphragm or the pelvic floor. So, when you will see this attachment of your pelvic diaphragm, the pelvic diaphragm attached on the ischial spine, and you know that your pelvic, this lesser sciatic foramen lies below the ischial spine. The upper is the greater sciatic foramen and lower is the lesser sciatic foramen. So, this is important thing to understand, that because the origin of the muscles of pelvic diaphragm are at the level of this point, they are not below. If suppose the origin of the pelvic muscle comes from here, then what will happen? Both these foramen become the part of pelvic cavity. But it is not like that. The origin is from here. So, the greater sciatic foramen become the part of your pelvic cavity and lesser sciatic foramen become the part of perineum. So, there are two structures, those will actually come out into the gluteal region, make a loop, and then they will re-enter through the lesser sciatic foramen, and these are pudendal nerve and internal pudendal artery. So this is again the concept to understand that what is the communication. So lesser sciatic foramen work as a gateway for your structures inside the perineum from posterior side. Now in this video clip, we will see the relation of pelvic diaphragm and communication with perineum. So this is your diaphragm. You can see that it is taking origin from all around of your pelvis. Now when you will see the lower side or the posterior inferior aspect, you will find that this is your greater sciatic notch, or that has been converted into the greater sciatic foramen, and this is your lesser sciatic foramen. Now the important thing is that here is the perineal membrane and this is the free border of perineal membrane. So the structures will come out first in the gluteal region and they will enter like this into the perineum. Clear? The second important thing which you have to appreciate, that this is your diaphragm. Which diaphragm? This is your urogenital diaphragm. So whatever the structures are entering into the perineum from the lesser sciatic foramen, they first penetrate or first enter into these muscles of your deep perineal pouch. That's why you will find that pudendal nerve will enter into the perineum through this gap where you will have pudendal canal, and it enters into the posterior part of urogenital diaphragm. Clear? So this is why it is entering in the posterior part, because the entry gateway is present in posterior area, that is lesser sciatic foramen. So in this video clip, now you can appreciate the orientation of the pouches. Again, if you will see that where is the pouch, so for that you always have to first understand the posterior free margin of perineal membrane. So this is the posterior free margin of perineal membrane. Now if you will see, you will realize that there is a space below the perineal membrane that is up to the skin, which I have already told you, and there is a space above the perineal membrane, and the space which is above the perineal membrane is filled by the muscles. So here you have to keep this image in mind, that this is your upper part of the thigh, and if you will remove this upper part of the thigh, you have to first see the superficial perineal pouch from the skin till this perineal membrane, and the area above the perineal membrane which is filled with the muscles of urogenital diaphragm is known as deep perineal pouch. Clear? So this image or this video clip is showing that the perineal membrane is a line of demarcation below and above the perineal pouches. So now at the end, question comes is, what are the contents of perineum? We are reading perineum. Now if somebody will ask you, okay, what will you find in perineum? So there is a long list of the structure, but in nutshell I can say that you will have terminal openings of the GIT and urinary tract. You will have the external openings of reproductive system and the roots of external genitalia, which you can see in these two images below the perineal membrane. These are showing the superficial perineal pouch, where you can see this penile portion, you will see the crust of the penile portion, you have the bulb of the penis, you have the root of the penis. In this area, you have the clitoris, you will have the root of external genitalia. So these all structures are lies below the membrane, and they lies below the pelvic diaphragm in perineum. Now these are the two images where sometimes you have the question related to your pelvis and perineum. Now here, suppose if I am having this image, if I have to draw the first, where is the perineum? So first I will mark the attachment of pelvic diaphragm. So this is your pelvic diaphragm. Now once you will mark the attachment of pelvic diaphragm, why I am not marked here anteriorly? Because I already told you that anteriorly there is a gap or a defect is present, and this is a mid-sagittal section. So you actually cut the diaphragm in two parts. So that's why the anterior area of the pelvic diaphragm is not visible. And in this diagram, you are able to see this muscular region. This muscular region is not pelvic diaphragm. Why? Because the muscle which is present here in midline below this hiatus is urogenital diaphragm. Not pelvic diaphragm. So when you are taking the mid sagittal section, the muscles which are coming in the cut section are the muscles of urogenital diaphragm, because in midline, in anteriorly, you don't have the muscles of pelvic diaphragm, you just have the exit of your urinary system and genital system. So in case of this female pelvis section, if I have to mark the areas, so you will find that this is your superficial perineal pouch, and this area here is the deep pouch, and this is your lower part of the below the pelvic diaphragm. So this is your perineum, where you will have the opening of anal canal. In the same way, if you will see this male perineum, now where is the perineum and pelvis? So again, this is your posterior attachment of pelvic diaphragm. Now anteriorly, you have to find out the perineal membrane and urogenital diaphragm. Again, I am saying the students are having confusion that it means the pelvic diaphragm is not present anteriorly. It is not like that. The diaphragm is present anteriorly, but because it is having the hiatus in the center, so when you will take the mid sagittal section, you are having the gap, and this lower gap is filled by the muscles of urogenital diaphragm. So you will find these are the muscles here, and these are the muscles of urogenital diaphragm. And the lower covering of this urogenital diaphragm is known as the perineal membrane. So now it is clear that these regions are containing, these are the contents of your superficial perineal pouch, and these are the contents, that is the muscle is the content of deep pouch, and posteriorly this is your pelvic diaphragm. So this is your perineum, and in the perineum you will have the anal canal and opening of anus. So now at the end of this lecture, I hope you will have the overall idea of the perineum. We have not discussed in detail about the contents of superficial pouch or the deep pouch, but I tried to give you the basic orientation. What is perineum? What do you mean by perineal membrane? How to divide the superficial and deep pouch, and where will you find these all areas in the human body? So this is all about today's class. Thank you.